In Japan, it's common to see women in their 70s and even 80s riding bicycles, socializing in close groups, and living independently with confidence. In the United States, many women of the same age quietly pull away from social settings, not because of illness, but because of embarrassment. Doctors who work with older adults often notice something uncomfortable but rarely discussed. Many senior women begin to worry about body odor, especially intimate odor, and they assume it's just part of getting older. But here's the surprising truth. Aging itself does not cause unpleasant body odor. In fact, studies comparing older populations in traditional cultures versus modern Western lifestyles show a clear difference. The problem is not age, the problem is a habit. One bathroom habit, done with good intentions, is actually making things worse for millions of older women. It disrupts the body's natural balance, weakens protective systems, and creates the very odor women are trying to avoid. Most women were never warned about this. Many doctors don't explain it clearly. And because it's an uncomfortable topic, it often stays hidden behind silence, shame, and isolation. Today, we're going to talk about it calmly, respectfully, and clearly. You'll learn what this habit is, why it backfires as women age, and what simple, science-backed habits protect freshness, confidence, and dignity well into later life. Stay with me, because by the end of this video, you'll understand how to protect your body's natural balance and avoid a problem that most women don't even realize they're creating. As women age, hormones shift, skin becomes thinner, and natural protective barriers weaken. One of the most misunderstood changes happens in the intimate area. For most of a woman's life, the body maintains a delicate internal environment that naturally protects against odor-causing bacteria. This system doesn't need help. It's self-cleaning, self-regulating, and surprisingly resilient. But modern habits have taught women the opposite. We've been told that cleanliness means washing more, scrubbing deeper, and using scented products to feel fresh. For younger bodies, the damage is often temporary. For older women, it becomes a chronic problem. Doctors who specialize in gynecology and geriatric care see the same pattern again and again. Women complain of odor, dryness, irritation, and discomfort. They try to fix it by washing more often, using wipes, sprays, or internal cleansers. Instead of improving the situation, the symptoms get worse. This leads to a vicious cycle. More washing leads to more imbalance. More imbalance leads to odor. Odor leads to embarrassment, anxiety, and social withdrawal. The hidden problem is not hygiene. It's over-hygiene. As estrogen levels decline after menopause, the natural protective bacteria decrease. The tissue becomes more delicate. When harsh soaps, internal washing, or frequent chemical wipes are used, the body loses its ability to defend itself. This is why two women of the same age can have completely different experiences. One follows gentle, traditional care. The other unknowingly disrupts her body daily. The belief that cleaner is better is deeply ingrained, but in this case, it's incorrect. And the consequences go far beyond smell. Chronic irritation increases the risk of infections, discomfort, and even urinary issues that affect independence and quality of life. Understanding this hidden problem is the first step toward reclaiming comfort and confidence. The first habit is also the most important, stopping internal washing and harsh cleansing of the intimate area. This includes douching, internal rinsing, scented washes, and products marketed as feminine hygiene for internal use. Many women were taught these practices decades ago when medical understanding was limited and advertising filled the gap with fear-based messaging. In reality, the female body was designed to clean itself internally. This is not a modern opinion. It's a biological fact recognized across cultures and medical traditions. In Japan and other long-living societies, intimate care focuses on external cleanliness only. Warm water, gentle handling, no perfumes, no internal interference. Why does this work? Because beneficial bacteria need stability. They maintain a slightly acidic environment that naturally prevents odor-causing organisms from taking over. When soaps or chemicals are introduced internally, this balance collapses. For older women, this balance is already more fragile. Removing it repeatedly is like stripping the protective coating off sensitive skin every single day. The safe approach is simple. Clean the external area only, using warm water and, if necessary, a mild, unscented cleanser designed for sensitive skin. No internal washing, no sprays, no wipes with alcohol or fragrance. This habit alone often resolves odor issues within weeks, not because something was added, but because the body was finally allowed to restore itself. Doctors emphasize that feeling too clean is not a sign of health. Comfort, lack of irritation, and neutrality are the real indicators of balance. This foundation habit sets the stage for everything else. The second habit focuses on protection rather than cleaning. It involves how often and how aggressively the area is exposed to moisture, friction, and chemicals throughout the day. Many senior women use daily liners, synthetic underwear, or tight clothing to feel secure. Unfortunately, these trap moisture and heat, creating the perfect environment for odor-causing bacteria. Protection comes from allowing airflow and reducing irritation. Cotton underwear, loose-fitting clothing, and changing out of damp garments promptly make a significant difference. This isn't about style or comfort alone. It's about microbiology. Long car rides, walking, sitting for extended periods, and even light exercise can create moisture buildup. If the skin cannot breathe, imbalance follows. Another overlooked factor is over-wiping. Using dry toilet paper repeatedly on sensitive tissue causes micro-irritation. This can trigger inflammation, dryness, and vulnerability to odor. Doctors recommend gentle blotting instead of aggressive wiping and using water when possible. Bidets or rinse bottles, common in many cultures, reduce friction and preserve tissue health. This protective approach helps prevent small problems from becoming chronic ones. It reduces the need for medications, doctor visits, and the anxiety that comes with recurring discomfort. Most importantly, it supports independence. When intimate discomfort is controlled, women feel more confident leaving the house, traveling, and staying socially active. The third habit is about alignment with the body's natural aging process. As posture changes, pelvic muscles weaken and circulation slows. The body's ability to regulate moisture and tissue health declines. This doesn't mean decline is inevitable. It means support is required. Gentle daily movement, particularly walking and pelvic floor awareness, improves circulation to the lower body. Better circulation supports tissue repair, natural lubrication, and immune defense. Modern lifestyles encourage long periods of sitting, shallow breathing, and tight clothing that compresses the pelvic region. Over time, this reduces blood flow and tissue resilience. Traditional practices emphasize upright posture, relaxed breathing, and daily movement. These habits indirectly support intimate health by maintaining oxygen delivery and nerve function. Another key factor is hydration. Many older women intentionally drink less water to avoid frequent bathroom trips. This concentrates urine and can contribute to stronger odors and irritation. Proper hydration supports the entire elimination system. Clear urine, comfortable urination, and reduced odor are all signs of internal balance. Aligning with longevity means respecting the body's needs rather than fighting them. It means working with natural systems instead of overpowering them with products. When posture, movement, and hydration are addressed, many women notice improvements not just in odor, but in comfort, confidence, and overall well-being. All of this can be integrated into a simple daily routine that takes no more than 25 to 30 minutes spread throughout the day. Gentle external cleansing during bathing, choosing breathable clothing, staying hydrated, walking daily, and avoiding internal products form the foundation. These are not drastic changes. They are small, consistent actions. The key is mindset. In Japanese philosophy, there is a concept called kaizen. It means continuous, gentle improvement, not force, not perfection, just daily respect for the body. Longevity is not about fighting age. It's about adapting wisely. Your body is not broken, it is changing. And when you support it properly, it responds with resilience. Doctors don't warn older women about this bathroom habit to create fear. They warn because they've seen how easily it can be avoided and how much dignity and comfort can be preserved by understanding it. Start today by doing less, not more. Trust your body's design. Stay consistent. Protect your future self with small, thoughtful choices. Confidence, comfort, and freshness are not lost with age. They are maintained with wisdom.